Everyone will please rise and for the pledge and remain standing for the moment of silence. Ms. Knowles, will you lead us for the pledge?
Yes, sir. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First item is the approval of the agenda. Do I hear a motion to approve the agenda?
I so move.
Do I hear a second? Second. Any discussion? Hearing none, all in favor, vote aye.
Aye.
All opposed, no. Motion passed. Next item is the election of the chair. I'll open the floor up for nominations for chair for the calendar year 2021.
I nominate Mr. Mike Kidwell.
I second.
Any discussion? Any further nominations? Hearing none, close the floor for nominations, and by acclamation, Mr. Kidwell, congratulations.
Thank you, Mr. Dean.
I'll turn it over to you.
Thank the board. We'll move right into action and discussion items. Action item number 4. Action, if any, to reassign Brian Austin and appoint Brian Dean as the interim division superintendent. Do we have a motion to do so? Motion been made.
I second.
Do we have any discussion? If there isn't any discussion, all in favor say aye. Aye. Any opposed? Motion carries. All right, next is organization of the board. Action item A, do we have a nomination for a vice chair?
I nominate Gary Williams.
Second.
Motion is made with a second. Any discussion? All in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Next is appoint Lisa Willis to attend meetings of the school board in absence of the division superintendent. I'd like to make the motion to put Ms. Willis in absence of the division superintendent. Do we have a second?
Second.
Ms. Garrett with a second. Any discussion? All in favor say aye. Aye. Motion carries. To appoint Christine Wells as clerk of the school board and Karen Combs as deputy clerk of the school board. Do we have a motion?
I make that motion. So moved.
Do we have a second?
Second.
Any discussion? All in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Next is to appoint Brian Dean as the agent and Christine Wells as the deputy agent to examine and approve claims to authorize the payment. We have a motion.
Motion.
We have a second.
Please. What was the motion?
Motion to appoint Mr. Brian Dean.
Did you skip that?
Oh, did I? I'm sorry.
Yeah.
Yes, that's what I got.
Appoint Lisa Willis to sign Virginia Department of Education documents in absence of the division superintendent.
I so moved.
Motion's made. Do we have a second?
Second.
All in favor say aye.
Aye.
Aye. Any opposed? Motion carries. All right, Mr. Williams made a motion for action item E, I think it is. I marked through it. Do we have a second?
Second.
Any discussion? All in favor say aye. Aye. Any opposed? Motion carries. Next is F, appoint Christine Wells as the purchasing agent for the school board. Do we have a motion?
Motion. Second.
Motion with a second. Any discussion? All in favor say aye. Aye. Any opposed? Motion carries. Next is to appoint Ms. Vera Ely to serve on the Linwood Houghton, I'm sorry, I was thinking Holston, Governor's School Board. I'll make that motion. Do we have a second?
Second.
Any discussion? All in favor say aye. Aye. Any opposed? Next is H, appoint Rob Hines and Gary Williams to serve on the school board budget committee.
I so moved.
I'll second that motion. Do we have any discussion? All in favor say aye. Aye. Any opposed? Motion carries. Up next is designate school board members to serve as a liaison for the following committees. As we've listed on board docs, they're all there. Any discussion or anything anybody don't want to be a part of, is we can go ahead and speak up now. Myself, I don't need to change anything. I'm fine with it.
Sorry.
I think we're all good.
You got them up there?
Thank goodness.
So do we have a motion on action item I?
Motion.
Motion made, we have a second.
Second.
Second, any more discussion? All in favor say aye. Aye. Any opposed? Motion carries. Next is establish meeting rules and order for preliminary procedure, Robert's Rule of Order, 10th edition, modified version for small boards. This modified version, I will say, allows the chair to make motions, and I think we can change the agenda at any point. Is that correct, Will?
That is correct.
We can amend the agenda
It requires a 2/3 vote, but yes, you can amend
with a
it.
2/3 vote, okay.
Yes.
And board chair, vice chair can make motions. I know that was a different.
That's correct.
Okay.
Yes.
Do we hear a motion?
Also moved.
Motion been made. Do we have a second?
Second.
Any more discussion? All in favor say aye. Aye. Any opposed? Motion carries. And next is K, establish that meetings of the Lee County School Board will be held on the second Thursday of each month at 6 p.m. at the school board office. And I would ask this, at some point, if we ever get through this COVID mess, a lot of people in District 1 has said they'd like to come to the meetings at Thomas Walker. We used to do that quite a bit. I'm not saying let's go there every other month. If we could get a couple a year on that end of the county, I'd be fine to go to Dryden. I would care a bit, just to get in our schools, give people an opportunity in that particular community to be able to come that wouldn't come all the way up here. It's 45 minutes, basically 40 minutes from my house to here. A couple times a year. That's something to think about. That's the only thing I would like to ask of the board.
I've got no problem with it. I think it makes a very commendable thing.
It can actually be fun if you want it to be. So, action on action item K, do we have a motion?
So moved.
Motion been made, do we have a second?
Second.
Any more discussion? All in favor say aye.
Aye.
Any opposed? Motion carries. Up next is recognition. Do we have any recognition?
Mr. Chairman, we're continuing not to do that just with social distancing and small groups.
Right. So up next, public comment. Do we have any public comment tonight? If not, moving right along. Do we have any board comment tonight?
I just like to thank all our teachers and their staff and everybody that's worked so hard through this troubled time, and I believe they're really doing the best that they can, and I just thank them for the job that they're doing. And I appreciate each and every one of you out too.
I've said it a million times it gets so far, but I don't like the remote learning. I don't think it's effective. I don't think it provides the best opportunity for our students and their education needs. But, you know, the last month or so, I've gotten a list every day, and there's probably been 20 plus people that are new cases every day. So I think that we're doing the right and safe thing by at least providing remote right now. And I think we're going to try to do that for another couple of weeks, and just with the teachers that haven't had a chance to be vaccinated and stuff, to see if we can cycle through this, maybe return to school in a safer environment. So I wanted to mention that. I also want to say that I really appreciate the work that Dr. Brian Austin's done during his tenure as superintendent of Lee County Public Schools. When I first came on the board 5-6 years ago, whatever it is now, we had a lot of schools that needed new roofs. We were like 3 payroll periods behind, which was millions of dollars. Owed millions of dollars in early retirement plans. Teachers and staff's insurance premiums for their health insurance were being passed on to the employee every year, 10-15% a year. All that stuff stopped Roofs are getting put on and have been put on. We've been making up the payroll deficit that was left to us by other school boards. We've started working on fixing certainly the middle of the salary scale in particular, where that we're getting beat up by losing people to Wise and Scott County because they're paying so much more in that 10 to 20 year range. So he's done a really good job, and I'm sad to see him leave. He's a friend of mine, and I hope we find somebody that's as good as him. I don't feel confident in that, but we'll see what happens. But anyway, I want him to know how much I appreciate the work he's done.
Well, I appreciate everyone working together, and this has been a really bad time during the COVID. And I know that lots of times you think that the students are getting so far behind, but it's not just here. It's county, it's statewide, it's nationwide, probably even worldwide. And I feel like with children, there's a way that we can hopefully catch the most of them up. And even during regular school years, you always have a few that lag behind. So, and I do appreciate the board's work in the previous 4 years, and I hope that we can continue to go forward in a great direction.
Any other board?
I'd like to say I appreciate all the hard work and the time Dr. Austin put in the school system. And I appreciate Mr. Dean stepping up and taking the position as being interim. And I look forward to that. And I look forward to all of us working together for the betterment of our school system. And we want to make good decisions, fair and honest, and the safety right now since we're going through this pandemic. And I just want us to move forward and work together.
I'd like to say that the same. I also want to thank Mr. Dean for stepping up being interim for us. Probably the worst time ever to step into a job like interim superintendent. It's about like being on the school board. I also want to thank Dr. Austin for what he has done while he has been here. I, along with Mr. Hines, came in 5 years ago, and he helped get us through a lot of mess that we was in, not only falling roofs, but just corruption. I mean, plain and simple. You work through corruption and fix a lot of things. It's hard to keep friends when you do that. But I do appreciate what he's done. I hope him and his family move forward and wish them the best of luck. Any other board comment? If not, we'll move to consent agenda. Do we have a motion to approve the consent agenda?
Motion.
Motion been made. Do we have a second? Second. Discussion. Do we have any discussion? I've got a few if nobody else does. I looked through some of the bills last night while I had time, but I'm going to ask Mr. Dean on some of this and Ms. Van Zett, and you can chime right in if you like to. But the VOTEC water bill for the Career Center was $4,781.23. I thought that was high.
It was high. We've had a leak and we've addressed it and we've reached out for an adjustment.
Great. And the same way with the Rose Hill water bill, it's $1,533. I mean, the other schools around is 4 to 5, maybe 7. Could be something there too, I don't know. Looks like we paid Mr. Wayne Baum $1,200. Didn't know what that was for, the way it was listed.
He was the clerk of the works for the roof project at Dryden, and he kept an eye on the contractors up there and make sure everything was done the way it needed to be done.
So was that a 1-month deal, or is it continuing? Or?
No, he is turning his final time, and we have the roof completed at Dryden, and we've got the warranty.
Okay.
Now let me ask this question. If you had a engineering company hired on the side, would you have to have clerk of the works like that, or?
You may not have to, but if that provides us with a person of our choosing to be there every day to make sure that they're not shortcutting something or not doing exactly what they're supposed to be doing.
I mean, I'm not saying anything at all against Wayne, he's a friend of mine, but I just wondered, because I know in years past, the board has hired to be on standby or had them ready in case there were issues, engineering.
Yeah, we've got architects and engineers, but this was just a person that just monitors it daily and makes sure that progress is going, and if we have any hiccups, they can address it there on site.
And you were talking about those expenditures. Sometime I would like to get with maybe Christine or Mr. Dean. I have a few questions, and they're just personal questions. I want to know what it is, because I went for a year not knowing or not checking into all this, and I think it's time to account for everything, to learn and account for everything.
I think they'd be happy to answer any question there. And I've got two more. Lonesome Pine exterminators, $27,338.
That was for the termite treatment for everything on this side of the bridge. So it includes this building, Fort Quillen, the main vocational, and all of the outbuildings. And that is the last building that needs to be termite treated.
Hopefully we'll never see a termite.
I hope so.
And what's that happen, every 10 years or something?
Well, I think we've got a lifetime warranty if we stay with that company, but if I see a termite, I'm sure we'll get a call.
Last one, Timberlake Smith, attorney-in-law, $6,582. Go ahead.
That deals with litigation involving that.
For the gym, wasn't it?
The Lehigh Gym.
Lehigh Gym.
And this is a question, we can discuss it publicly fine. Do we need to keep spending that money? I mean, the gym floor is fixed, seems like if we spent the money to fix it.
Discuss anything dealing with litigation in closed session as far as that goes.
So we need to talk about that in closed session.
Well, technically, we don't have legal on the agenda for closed session, but that would be a closed session.
Yeah, we don't have to.
Right, okay.
Yeah.
That's it, thank you, sir.
You're welcome.
All right, we got a motion, we got a second, any more discussion? All in favor say aye. Aye. Any opposed? Motion carries. Any reports of the board? If not, moving on, reports of the division superintendent, Mr. Dean.
Looking at enrollment, it's up 2 over last month, which is a good thing because our budget was based on 2930 and we were at 2931 last month. So that is trending the proper way. On the Kingsport Times News drawing cards and right on, if you haven't looked at those, I highly encourage you to do so. There's a number on there from Jonesville Middle and Pennington Middle, some little short stories about family, and I encourage you to look at those. Operations, instructions, and technology updates. We posted that and you can go through there and look. I would like to add a thank you to the maintenance team and the custodians who had to work quite a bit over the holidays because of those cold temperatures. We couldn't turn the furnaces off and they had to stay with them. Those nights it was single digits, so I would like to say thank you to them. Technology-wise, all of our Chromebooks have came in. We're in the middle of getting those out at the middle school. It's been a little difficult with remote, but I think as people come by and pick up either a meal or a packet, they're getting their Chromebook. We've developed a partnership with Frontier Health, and I think we've got Miss Heather Krause and Miss Sarah May, one of our SAP counselors here, who can talk about that, and I think it's going to be a great opportunity, so I'll ask them to come forward and talk about that for a minute. And before they do, I'll go ahead and do E. Just a reminder, we've got Head Start, kindergarten, and pre-K registration January 21st. I think you can do that remotely, and if they call the schools, we'll make sure that we have a computer set up so they can come in and register their kid for next year. But I'll ask Miss May and Miss Krause to come up and talk about our partnership with Frontier Health.
Hello. So for those of you who I've not got to meet in person, I'm Sarah May. I am the SAP coordinator for the county Student Assistant Program. And before COVID, Heather and I had been talking about the need for more mental health services for our students inside our campus walls. We have some programs already going on in all of the different schools. It's just not enough to cover everyone that we have. So we have been partnering together to put in place several different opportunities for our students, and the big one that after COVID we've been able to put into place is Lehigh is going to be our pilot program to have outpatient counseling services available on our campus for students who need the service, qualify for the service, their parents want the service. We actually have a counselor from Frontier Health who will be available 1 day a week right now to start off. She will be providing counseling services to those in need, and especially right now with COVID, the anxiety levels, depression levels, trauma levels have increased significantly. And our students are doing very well managing it, but some are struggling, and I think it's a wonderful opportunity to have this in place. Along with that, so this is going to be a pilot project right now at Lehigh just to see how it rolls out, how it works. My goal, my hope would be to have it there 5 days a week instead of just one, and then branch it out into our other schools as needed. We have also partnered with Frontier Health with the prevention services to get a program started that Heather can talk a little bit about at Pennington. I wanted to say Jonesville, but no, it's at Pennington Middle, and it's called TNT. And this is a program focusing on alcohol, substance abuse, tobacco, and this is very much needed as well. So we've got that in place, and then we have a telehelp service also that will be rolling out countywide to our kids. And I can turn it over to Heather, and she can give you guys a little bit more information about that. And if you have any questions, I'll be happy to answer it.
Is there an age limit
For which one?
for either one?
The outpatient in the schools will just be at Lehigh for right now, so that'll be our high school aged kids. TNT will be at the middle school, and then the telehelp, I'm not sure if there's an age limit with it.
No, there would not be an age limit, and the children's mobile crisis also is not restricted to age.
So any other questions I'll be happy to answer, then I'll let Heather tell you about what we got going on. I'm really excited about it. I'm very, very excited, so.
All right, well, thank you for inviting me to be here this evening. The outpatient services that we'll be providing at Lee High School will include evaluation and assessment, diagnosis of mental health disorders, behavior management, treatment planning, service coordination, psychoeducation, and of course referrals for additional services as indicated. Right now we didn't want to exclude the remote learners. And so with the pandemic, we would be able to offer telehealth services. The therapists at Lehigh would be able to offer telehealth services to students. We hope that that will extend beyond the pandemic, but that will be dependent upon the insurance companies allowing it to continue once the pandemic is completed. The Children's Mobile Crisis Program is a new program that Frontier Health launched in September. It's available to all of the schools in the county, and it is a service when children experience acute crisis and need interventions to prevent them from ending up receiving inpatient hospitalization. We now have a program where a crisis therapist can respond to the school, to the family's homes. So that will be an additional support that we are able to offer. For counseling services now for the other schools, we do have a telehelp service by a therapist that works for Frontier Health, but it would not be the therapist that we have at Lehigh, to provide some brief counseling or short-term crisis intervention to students at the other schools. So we're excited about the partnership and to have those opportunities. Definitely want the services to grow and expand. The last service is the prevention team. Mrs. May and our prevention director, Amy Bledsoe, has worked together for this project, and we will be submitting in our grant to add Pennington Middle School to receive these educational services. It is called Tobacco, Towards No Tobacco, TNT. It's a designated compendium program by Virginia Foundation for Healthy Youth. It's an evidence-based program. It's a comprehensive 10-day curriculum that has been proven to help youth say no to tobacco use and other forms of tobacco.
it prevents the teams by changing their preconceptions about tobacco and helps them with decision-making skills and communication skills. So again, thank you very much for the partnership, and very excited about this for our students.
Thank you. That it?
Yes, thank you.
All right, moving right along to unfinished business. We, action item A, if any, to approve the calendar for 2021 and 2022 school year third review.
I think a copy of that is in the packet, and we included the responses from the surveys we sent out, and I know there was a lot of discussion from you all about whether to include the last 2 weeks, or those 2 weeks remote, the January 24th week and the February 21st week. And looking at those responses, I mean, the majority wanted to keep them, but it wasn't, I think it was like 55 to 45 or 59 to 41, so we would just ask that.
From the majority of what I've seen, was the majority of the people taking this survey teachers?
Yes.
So I thought. Mr. Dean, can I ask an off-the-wall question?
Yes.
How does the health department, I know things has changed on reporting and contact tracing, and these ladies back here may know a lot about it too, because I don't. My son just was in contact with a coach that tested positive. You know who told him to quarantine?
Probably coach.
The coach. Okay. He lives with me and my wife and my daughter, but who's telling them? How's this thing running basically now from what it was last month?
Well, in the past, we would get an official letter, or everyone who tested positive would get a letter stating when you're in isolation or quarantine and when you could come out.
From the health department?
From the health department. We have been notified they are no longer going to do that.
Any reason why, or just?
I think I read that they were going to start focusing on vaccines and change their focus. And we're not going to get the quarantine letters, we're not going to get the isolation letters.
So we're going at this in the blind. Is that basically what?
They're putting it more on the person who tests positive for you to reach out and talk to the people you have been in contact with and tell them that they need to quarantine.
From my understanding, they're overwhelmed right now. There's so many that they just can't do all this.
I think in the
Now,
last...
that was my understanding of what I've read.
And in the last 2 weeks, I think we've had 370 cases in the county. So that's a fifth of what we've had during the entire pandemic. It's happened in the last 2 weeks. So I would say they are overwhelmed. And I know healthcare providers, I think, are encouraging people to quarantine when they get tested positive and reach out. But we're not going to get the formal documentation that we've had in the past. It's going to be more of an honor system.
So if an employee comes and says, I'm in contact with somebody in my house or whatever and I need to quarantine, there's nothing you can do about it?
We're going to have to take them for their word.
And that's basically asking them. Sounds like it's nothing from the state.
No.
Nothing.
We're not going to get any official documentation.
Nothing from a doctor?
Well, if they're a contact of someone, there won't be anything from a doctor, because the doctor will tell you,
Right.
You need to reach out to your contacts. We could maybe get something, if someone tested positive, we could ask for a doctor's excuse, but as far as a contact, there won't be any formal documentation.
Do we need to ask the employees of Lee County Public Schools to formally let the superintendent know, or somebody in administration, versus put it on Facebook saying I tested positive?
We would prefer that, yes.
I don't know how else to say it.
I mean, we want them to call us and let us know. That way, if we get back to in person, we've got to plan accordingly, and we need to know.
The only reason I'm saying it is because the health department's not going to tell you now. If it's what I understand.
And I may ask Ms. Willis, she might be able to help me with this, but under the current procedure, a person can be off work for up to 80 hours because of COVID, and we've extended that, I think, through the end of the school year. But we need to know who's off, and we need to know if it's COVID related, so we can know whether or not they're going to have to lose a sick day, or if it's under the pandemic cause.
So,
But
So as a board, do we need to discuss a document maybe to ask people to, what do we need to do? Because I think these people's gonna need help dealing with this, and they don't have it from the health department right now.
Well, it's been my understanding that some teachers are going back before their quarantine's up because they're afraid they're going to get their sick days pulled.
And if they would reach out to us, we'd be more than glad to tell them exactly what's going on and,
Not Facebook.
correct.
You can't just put it on Facebook and expect everybody to know.
And that's if we know. So, I mean, we'll help anyone through that. But if anyone has a question, they need to reach out to myself or Ms. Willis, and we will tell them, if you're under quarantine, you do not need to come to work.
Right.
You do not need to, possibly expose anyone else just in case.
Well, if I could speak to that, I actually sent out an email to everyone in the division when we had discussed, since the FCRA provisions sunsetted on December 31st, that we wanted to extend those same policies to our employees for the remainder of the year. And everyone got an email to that effect. And it has like the procedures.
Right.
And I think administratively, we have a principals meeting in the morning. I can tell them to encourage all of their staff, not just the teachers, but bus drivers, cooks, custodians, that they need to inform their supervisor, and they can send us a list, or they can just call us and let us know. And if that doesn't work, we may need to, possibly make a school board policy along those lines, but I think administratively we could encourage them and take care of it.
Yeah, it's tough when the health department has stepped away from the tracing part of it.
But it's just not Lee County, it's
Right.
statewide.
Correct.
So, action or discussion on the calendar year for 21-22. If any, we can talk, we can vote, we can do whichever.
Well, I think we probably need to go ahead and approve it, but because this past year, how many times have we amended it? So we can always amend it if things get a lot better and we don't need these virtual days. My thoughts. This needs to.
Well, yeah, I don't like the built-in remote days because
Right.
hopefully we'll be past this for next school year.
Hope so.
But if we do vote on it and approve tonight, we obviously will have the option to come back and revisit it, so I can live with that.
Mr. Williams, you got anything, Ms. Garrett?
I'm fine with it.
I'm good with it.
So you need a motion?
Yeah, I'm just debating on whether to comment or not. I hate to give in to this thing because I'm hoping, like Ms. Ryan said, this will move on.
We all do.
This country is in a mess, not only COVID-wise, politically, it's just a mess. And Lord have mercy, we need to move. But myself, we can go with what we got for now, but if in any way possible, I'd like to get our kids back in the building. Because I think it's a necessity that we need to, and they need it. My kids need it. I think we all, what's your thoughts? You're going to be the division superintendent going right into next year.
I want as many kids in the building as possible safely, because I know that they learn better inside the building than they do remotely. I mean, we're doing better, but I think they need to be in the building as much as possible.
All right.
I mean, y'all can do it either way. We could take it out, and then if the pandemic happens not to be over, we could change it, and you all could meet and change that, or we could do it the other way. That'd be up to you.
Right.
I think we need to just leave it in and then amend it later on, because we don't know, hopefully. We all hope that, it's over and gone in a few months, but it might just be a dream.
Well, with vaccinations,
We should help.
that will help, hopefully. Getting the teachers vaccinated and public and everyone involved.
All right, do we have a motion on the school calendar?
I make a motion, I so move.
Motion been made, we have a second.
Second.
All in favor say aye. Aye. Any opposed? Motion carries. Next is action item B, if any, to require administration to report the county positive COVID-19 cases, specifically by number of affected students and/or staff by the school, and to post a cumulative, I can say it, totals by the school division on the division website effective January 18th, 2021. This is the second review. Mr. Hines brought this up, if you want to talk about it.
Well, I just think that we need to be as transparent as possible on what our numbers are and how it's affecting the schools. And one of the things that when we've had to make decisions to shut down in-person learning and stay solely remote is because we've seen increasing numbers of staff that have it. And then you get into the whole issue, even without a pandemic, without the flu, the last couple of years since I've been on the school board, we've had trouble finding substitutes. It's a very difficult situation. Then when you have this come in on top of us, makes it almost impossible at certain times to staff our schools appropriately and as needed. So I think I want to be able to keep up with the numbers in the schools and know what's going on. I want the public to be able to have that same access to that information.
And basically, it's going to be, if we get a positive case, say Lehigh over here, and you're either going to report that it's a student or a staff member. Not and or, but one
Exactly.
or the other.
Yeah.
One or the other. You're not going to call names, obviously, but
Correct.
that's what this is about.
So you think legally that will be okay?
Yes.
Okay.
And I will say, going on with the previous conversation, the numbers will be as accurate as we have, because if
Sure. Right.
we don't have the formal documentation from the staff, and so they won't be letters, we'll just be taking people's honor that they have telling us that.
We can only report what's reported to us.
Correct.
And that's kind of been going on for a while, even when the health department was working. I remember Dr. Austin said it was like an honor system, that the students reported this, or the parents of students.
Our students have been going to school, supposed to be in quarantine, and then a couple of days later, they find out they're positive.
We did have a number of that before we went back to remote. We had students who should have been in quarantine, but they showed up to school, and when they tested positive, it affected a whole lot more people.
There you go.
So not being responsible citizens is brought a lot of this on.
Yes. I mean, from the time I was a principal, we always encouraged, if you didn't feel well and you were sick, don't come to school, and that's even more important now. And if somebody calls you and tells you you probably should be in quarantine, don't come to school.
It's a mess, for lack of better words, to still there again. When my son had to be quarantined, he was around the coach that was positive, the whole team quarantined. Should I have quarantine? Should my family have quarantine?
No, you'd be a contact of a contact.
Okay, he had no symptoms, he tested negative, thank goodness, but that's where you get, but sending your kid to school after testing positive is just crazy.
It is.
I mean, that's just not, it's
Very
not smart.
irresponsible.
No, I'll say that, and it ain't the kid's fault, that's the sad part.
Right.
All right, do we have a motion on action, or unfinished action B?
So moved.
Motion been made, do we have a second?
Second.
All in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Up next is action, if any, to appoint hearing officers per school board policy GBM-R, procedure for adjusting grievances for professional staff, and they was listed, folks in the packet there.
Mr. Massey and Mr. Smith have agreed to do that. There's no cost unless we have a grievance and they have to come down there and come down here and hear that, then there will be associated costs. But I think in the past we had 3, but one of them declined to continue, and administration recommends we approve the 2 gentlemen that's on that list.
Who are they, Brian?
It's Mr. Massey and Mr. Smith. They're former superintendents, and if you do have a grievance and they have a grievance hearing, they would come down here and listen to that.
They're not from here, that's outside people coming in and listen to the actual grievance, to try to say that.
Thank you.
We have a motion for action item A.
I so moved.
Second.
Motion been made with a second. All in favor say aye. Aye. Any opposed? Motion carries. All right, next is B, action if any, continue with remote instruction through Friday, January the 29th, and return to in-person instruction on Monday, February the 1st. Mr. Dean, you want to speak to that?
This is administration's recommendation. Like I said, I think every kid needs to be in school. That's where they're going to do their most learning, but I also said that they need to do that safely. And with 370 cases the last 2 weeks, I think we still need a little time to get through that. A number of staff members got shots, and they have reached out and said they would like for some time, hopefully for those to start being effective. And our recommendation is that we hold off and continue remotely until we come back on February the 1st.
Where are we at with staff and buildings right now, schools wise?
I talked to all the principals the other day, and I think I had 2 that said that they probably could not operate right now if we did go back, and some others said, we're not sure.
Now, we've had a couple new cases today that's...
Correct.
That's actual staff members.
And that might have changed when I talked to them the other day. And it's difficult, and like Mr. Hines said, it's difficult to get substitutes. So our recommendation is we hold off till February 1st.
Well, I think it will help also for the faculty and staff to get their second vaccine during that time.
When did they get that second vaccine?
I don't think anyone that received it over here will be good till February the 8th, so it'll be sometime after February the 8th.
Okay.
But the thought process is that the first vaccine will build up some immunity, and they've asked that, have a little time for that to work.
Was Moderna, was that?
Yes.
Okay. Isn't that 3 weeks they take the second shot, or is it 4? One of them's 3 and the other one's 4.
The email I got, I couldn't get anything till I took the shot, and it was February the 8th is when I can get, after that I can get the second shot.
Okay.
Any more discussion? If not, do we have a motion on action item B?
Also moved.
Motion been made, we have a second.
Second.
All in favor say aye. Aye. Any opposed? Motion carried. All right, can I hear a motion to go into closed session, and we probably need to discuss personnel, possibly
Somebody put the code section up here,
code section, please, yeah, we forgot that.
closed session.
I set it in front of you.
Oh, you
It's on
did?
the tan paper.
Oh,
I got
okay.
you.
I wondered what that was for. So I'll make a motion that we go into closed session to discuss personnel under Virginia Code 2.2-3711A1.
Motion been made for closed session, I'll second it. All in favor say aye. Aye. Any opposed? Motion carries, we're now closed.